Today, the FDA overruled Donald Trump, who had been promoting the drug hydroxychloroquine nonstop. The FDA just revoked emergency authorization for those drugs after growing evidence showed that they don't work and they have deadly side effects. You know, the drug that Donald Trump said, I think he was lying, he was popping like candy and that everyone should take.
I happen to be taking it.
Hydroxychloroquine?
I'm taking it, hydroxychloroquine.
When?
Right now, yeah. But I've heard a lot of good stories. And if it's not good, I'll tell you right, I'm not going to get hurt by it. A lot of people are taking, a lot of frontline workers are taking hydroxychloroquine. 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 That's hydroxychloroquine. Hydroxychloroquine. I keep talking about hydroxychloroquine. Hydroxychloroquine. I don't know. It's looking like it's having some good results.
His followers listened. That drug obviously has real usage for other diseases like lupus and malaria, which it's technically what it's originally supposed to be for. But there were shortages of it because Trump has enormous power. I know this might shock people as the president of the United States. Just by the words that he uses, his followers hoarded the drug. And potentially it could have really harmed some of them because it is a very potent medication. And the FDA was like, no, we cannot continue to go down this path. And they're technically the Food and Drug Administration, a part of the same Trump umbrella that everyone else is. And they were like, oh, no, this even goes too far. More details on the decision today. U.S. regulators revoked emergency use authorization for 2 malaria drugs touted by President Donald Trump as COVID-19 treatments after determining they were unlikely to work against the virus and could have dangerous side effects. Chloroquine and hydroxychloroquine are unlikely to be effective in treating COVID-19, the Food and Drug Administration said Monday. Additionally, in light of ongoing serious cardiac adverse events and other serious side effects, the known and potential benefits of CQ and HCQ no longer outweigh the known and potential risks for the authorized use, the agency said. In France, health authorities said heart risks and deaths have been reported in COVID patients receiving anti-malarial drugs. Late last month, a global study of patient records in the Lancet Medical Journal suggested similar dangers, but the article was retracted after doubts rose about the data underlying the study. Since then, a robust study from researchers at the University of Oxford failed to show benefits from using the drugs in COVID patients. So fine, take away the Lancet study. There are many studies that show that there were adverse effects here, and the FDA even when there's pressure from the administration, even when there are bureaucrats in the FDA that are a part of the Trump team of lackeys, whatever. No, they were like, we can't do this. This is not safe. And the FDA, as we know, is very willing to cut corners for pharmaceutical companies and for for-profit industry in the United States. So that's how bad it has to be. That's how incompetent, that's how stupid Donald Trump has to be. There are loose ties potentially that he has financially to hydroxychloroquine manufacturers, but I think the number one reason that he kept pushing this is because he has to be proven right. As studies and information cropped up that said, no, this might not be good, he has to double down. He has no other mode, and he continued to do so, but his doubling down is dangerous and could potentially really hurt people. We'll never know how many people he hurt, but I'm sure he did many.